said, wait a minute, these people who are under stress, their blood sugar control is going completely out of whack. What's going on here? That was a diabetes study. And so we were looking at these people to try to, one of the problems with diabetes medications is that they do this. Diabetes medications keep your blood sugar control, mostly from going too high, right? And so it pushes it down. The problem is those diabetes medications flatten your blood sugar too much. You actually want to use diet to let it fluctuate some. You want a normal fluctuation, but not a wide fluctuation. But at the same time, you don't want no fluctuation. So people on those drugs would have no fluctuation, and they'd actually gain weight. You know, and so that's another thing that was confusing for a while to figure out. We're saying if you're going like this, you're more likely to gain weight. If you do just a little bit, you're likely to lose weight. Maybe if we flatten it completely, they'll lose weight like crazy. And they didn't. It really is, the body's weird. It doesn't want too much of anything. It wants to be in between. And so in between really is the way to go. So we had these people who were diabetic, and they were losing weight, their blood sugar control was good. They're one of the areas that I study a lot is how diet makes us feel. So I measure a parameter called vigor, mental and physical energy levels, and we manipulate the diet to get people to feel worse or to feel better, and we see how the biochemistry changes. So these people were feeling really good. And there's a measurement that a lot of diabetics are very aware of called glycosylated hemoglobin, which is, there's a protein in your blood that carries your oxygen, that if your blood sugar level is too high, this protein can get glycated, and you can measure that in a blood test. So it's a measurement not of their day-to-day or minute-to-minute fluctuations in blood sugar. It's a measurement of how their blood sugar has been changing over about 3 months.
Processed.
Over time. And so these people in our study, this is a three-month-long study, their glycosylated hemoglobins were going down like crazy, which is good, showing that over time, days and weeks and months, their blood sugar control was in much better territory. So they were getting from their doctors, they were coming back and saying, I don't know what you're doing right now, but just keep doing it because your blood sugar control has been great. You know, and that's a significant benefit for their overall health, because if that's happening to this blood protein, it's also happening to their artery linings, it's happening to their heart, it's happening to their brain tissue. It's kind of damage you don't want to have in your body. So yeah, something like this would be perfect